Hi, I'm Christian with Forest of Art and Healing Arts. And in this video, I'm going to show you some exercises that you can do to release tension in your neck and the connection between the uppermost part of your neck and your head. Tension in this area of your neck can cause stiffness, pain, headaches, high blood pressure, and a number of problems arising from cranial misalignment, including vertigo, tinnitus, and even visual problems. Most people do not have much awareness of how they hold their head on their body, and the goal of this exercise is to gain some awareness, gain some coordination, and to be able to relax the connection between the two body parts. When the neck starts to tighten, the ligaments and the connective tissue start to harden and get stiff. The joint capsule between the vertebrae start to stiffen up as well. And this will lock your head into a position, usually a characteristic position that goes with your posture. A stiff neck can cause compression of the tubes that run through this area. We have arteries, veins, nerves, and lymph vessels that run through this area, and we need to keep the neck loose so that the fluid can run through these tubes easily. One of the arteries, the vertebral artery, when it's compressed, it is one of the major causes of migraine headaches. One of the nerves, the vagus nerve, when it's compressed, it can increase blood pressure and cause overall feeling of anxiety and stress in the body. Gaining awareness of your suboccipital region can allow you to voluntarily relax the area whenever you need to, and thereby prevent the problems caused by it being tight. Now, I'm going to show you some anatomy of the area. I think this is important for you to be able to visualize what it is you're doing. This is what makes the exercise a mindful movement exercise. If you want to cut straight to the exercise itself, see the timestamp below. Let's begin the anatomy by looking at the cervical vertebrae. There are 7 cervical vertebrae, starting with C1 here and coming down to C7 here. Each of these cervical vertebrae have discs in between them, here, 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 here. They have a transverse process here and a spinous process coming out the back here. The uppermost cervical vertebrae, what's called C1, has a transverse process on either side, just a little tubercle at the back, not quite a spinous process. And it has no body in the middle there, you can see. On close to the transverse process, it has these 2 condyles here, which are the bottom half of the joint that connects the head to the spinal column. So this condyle here is a shallow dish, concave, and we'll see in a second that the condyles from the skull fit there. Here's a picture of the skull, and you can see that here are 2 condyles. These are convex condyles, and they're going to fit on the 2 condyles on the atlas. This hole here is the foramina where the spinal cord moves through, and then you can see here where the muscles of the neck attach in the back of the neck and then in the front of the neck. The second cervical vertebrae has a body here, but it also has this part that sticks up out of the body, and it goes up into the space where the body of C1 or the atlas would have been. And C1 is going to rotate around this prominence here, which is called the dens. And that's the gesture that we make when we shake our head no. You can see that C2 also has transverse processes and spinous process, and ligaments and muscles are going to attach to that. In this picture, you can see C1 sitting over C2 and the dens of C2 coming up into this space here. And you can see how C1, when it rotates, it will rotate around C2. The rest of the vertebrae, C2 to C7, are separated also by intervertebral discs. And you can see here that the discs resist compression and also tension being pulled apart. When there's flexion and extension, the disc assists in that, and they can also resist shear here. Tension in the neck and shoulders compress these discs constantly over time, and this causes a deterioration of the disc, which can lead to arthritis or prolapse or any number of problems in the neck. In this picture, we can see that in between the vertebrae, there are ligaments between all of the vertebrae. And even here between the atlas and the occipital bone, there's ligaments there. Also here on the front of the vertebrae, there are ligaments. On the back of the cervical vertebrae, you can see this large sheath-like ligament here. Notice also, we'll look at this later, that there's a blood vessel running up inside the transverse process. And then here, it pierces that ligament on its way into the skull. These ligaments can harden if you don't move your head much. And as they harden and they become gristly, then they're not able to be flexible anymore, and then you actually lose the capacity to move your head. Here's another picture of the ligament. You can see that even inside the space made by the vertebrae where the spinal cord runs through, you have ligaments down here as well. And then in between the vertebrae, there are ligaments crossing in all different directions. And here, the dens is held in place by a ligament forming almost like a rubber band there. The head and neck is held in its place by many muscles. This is a transverse cut of the neck. You see here the front. These are the vocal cords right here. This is the back of the head right there. The vertebrae is here in the middle, transverse process out to the side, spinous process here. Look at all of this pink in here. These are muscles, many layers of muscles in back of the neck, and also layers of muscle in the front. We have a lot of muscles in the back of the head because the head sits forward of the fulcrum of the neck. And so the muscles on the back always have to have a little bit of tension in them to hold your head up. But when these muscles get tight, when they get chronically tight, then they compress our head down onto our neck, and they compress our vertebrae, and everything rigidifies and hardens. In this picture, you can see the attachments of the muscles on the skull, layers of muscles attaching in different places along the skull, both in the back of this large foramina and in the front of it. These spaces here, these holes here, are where nerves and blood vessels travel into the cranium. And then here again, you can see where the atlas makes its joint with the cranium. We could begin looking at the muscles of the neck, first at the superficial muscles, so the platysmus here on the front of the neck, the sternocleidomastoid here. We have muscles that come up from the back up into the neck, and then the large trapezius muscle. Notice that the force of these muscles comes right up around the back of the head and into that point where you feel headaches sometimes. And if you follow this around, you can even see how it comes down into your eye. You might feel headaches there. This tension is literally transported along that muscular and fascial line into different parts of your head. If we cut away here that layer of muscle, we can now look to the next layer of muscles here, coming from the rib cage and coming from the shoulders up into the head. And these also line up and can transport tension up into the head. This is one of the most important pictures, and I'd like you to sear this picture into your mind because you're going to be thinking about these muscles when you're doing the small movement. So if you look closely, you can see a triangle here. These are called the suboccipital muscles, and there's a triangle on either side. This is the spinous process of C2. This is the spinous process of C1. This is the transverse process of C1. And you notice that you have a muscle that comes across here, another muscle that goes up into the skull, and another muscle that goes over here. There's one triangle. This contributes to the triangle. This muscle here is cut, but you can see the triangle on the other side. So when these muscles contract, they're going to pull the head down in that direction or straight down if they're contracting at the same time. These make the small nuanced movements that we need to move our head about. I'm going to clear these lines so that you can see next a very important point here. This right here is an artery. That's the vertebral artery. And you can see that it comes out in between this triangle here. If this is tight, it's going to compress that artery. We also have muscles on the front of our neck. You can see this line of muscles coming up the front of the vertebrae. And there's many of them. They come from the transverse process, they come from the body, and they come up into the skull here. These muscles here, you can see them coming from the rib cage. Again, sense of triangles all over the body. And these are going to control movements down and forward like that. If one side contracts, it moves the head to the side like so. Now, the balance and movement of the muscles is inhibited by tension and uncoordination. As the neck tightens more and more and certain movements are never executed, the tissues stiffen and the range of motion decreases. If the range of motion decreases and the tissues stiffen, then we start to compress some of the tubes that run through this area. Now, this is kind of a longitudinal view here of an important artery I've been talking about. So the heart would be about here. This is the aorta coming out of here. And from this artery here, you can see the vertebral artery coming up through the transverse processes of the vertebrae, turns here at the atlas inward and goes into the brain right there. In this picture, again, you can see the vertebral artery coming right up through the vertebrae here, and then it turns right here and goes up into the cranium, and you can see it along the floor of the cranium up into the fascia of the brain along here. This is one of the causes of migraines when this artery is compressed. This movement exercise is going to help with that. Of course, it's not only arteries that can be compressed, but also the veins. You see the veins here coming up through the vertebrae, close to the vertebrae, and up into the cranium to drain. So the direction of blood flow is going to go this way, back down towards the heart to drain. And if these important veins are compressed, then you don't get good drainage out of the brain and the cranium. We also have to consider nerves. These are called cranial nerves. There are many. I just want to talk about one. The 10th cranial nerve is called the vagus nerve. And the vagus nerve, you can see here, this is bone. This is the occiput right there. And so it's coming in through a foramina right here. And the atlas is going to be down here. So if this gets compressed, it won't work as well. So what does the vagus nerve do? This is the major parasympathetic nervous system nerve. It calms us down, it stimulates the digestion, it lowers blood pressure. And it's been found that if the vagus nerve is compressed, that this can actually increase your blood pressure. So now let's consider what we're going to do during this exercise. Here you can see the outline of the cervical vertebrae inside the neck. Notice that the first cervical vertebrae comes all the way up here to the ear, so that all of this part of your face is actually below the base of the skull right here. So this is what we're going to be moving up and down in this exercise. We're going to be moving in 3 planes: the sagittal plane, frontal plane, transverse plane. So let's consider first the sagittal plane. This is the plane made when you draw a line through the skull in this direction, producing a right and a left. If you were to rotate the head around that plane, you're making the gesture yes. This yes gesture, which is a flexion and extension of the occipital joint, is accomplished, as you can see here, by sliding the condyles, head moving forward and then head moving back in this picture. So the joint capsule around that joint needs to be loose enough to allow for a sliding, and the joint needs to be lubricated. If you don't move the joint a lot, the lubrication dries up. The way to get lubrication back is to move your joint, and that's what we're going to be doing. We're going to be moving this back and forth like that and relubricating the joint and loosening up the tissue around it. We can see in this picture how the fulcrum is here, and much of our weight, center of our gravity, is in front of the fulcrum. So that's going to always pull down, and we need these neck muscles to be able to hold our head straight. Otherwise, like if we were to fall asleep in a chair or on a plane, our head typically falls down forward. So these neck muscles back here usually have at least a bit of tension in them. Now let's consider the transverse plane, movement in the transverse plane. So this is a line that is drawn across the skull in that direction. And when we rotate the head, we're making the gesture no. And this no gesture, this rotation of the head, is going to be accomplished by rotating the atlas around the axis. There's the dens right there. There you can see the rotation. And here's another view down here of the rotation. The final plane we're going to look at is the frontal plane, which is made by drawing a line across the skull in that direction. And so a rotation like this to the side and then to that side makes a gesture that might be saying maybe. Lateral flexion is going to be made by shifting the occiput across the atlas here in the occipital joint. You can see here the movement from one direction to the other. Now we're going to do the exercise. Before you do the exercise, you want to loosen your shoulders. And a good way of loosening your shoulders is to go out and take a walk. Just a 10 to 15 minute walk. And you have your hands outside of your pockets, so not in your jacket or trouser pockets. Let your arms swing as you walk in a cross crawl like this. And let your shoulders move, your head and neck move in a relaxed manner. If you have a hard time letting go of your shoulders, we have some videos that show you how to work your shoulders. So we have a video called Shoulder Flossing, which we'll put a link to up here. And we have another video in which we show how to use yoga tune-up balls on your shoulders doing self-massage to release your shoulders. Sometimes people have a hard time letting go of their head because this muscle here, the sternocleidomastoid, is too tight and is pulling your head forward in front of your body. And so I'll link you to a video up here again where I show you how to use yoga tune-up balls to release your sternocleidomastoid. So once you've let go of your shoulders, to whatever degree you can, then come back and we'll start the exercise. Try to place your head above your body as best as you can. So you're standing up straight or you're sitting. You can do this sitting as well. Without forcing it, so without really trying to be ramrod straight, but not being hunched down like that. So have your head on top of your body as best as possible. Then what you're going to do is you're going to rock. So I'll show you here on my skeleton. You're going to rock your skull up and down like that, so you can visualize the anatomy that we were talking about earlier in a gesture as if you're saying yes. So it's a very small movement, very light and easy yes. Don't make it a workout. After you've done it for a minute or so, lightly, then you can move a little bit faster, get a little bit more mobilization in there, maybe even make the arc a little bit larger. So that's the first plane. The second plane, the transverse plane, is to then move the head around. So you're moving the atlas around the axis in the gesture that we commonly know as no, like this. So very small gesture. Don't use power, don't make it a workout. Lightly moving in the no direction like this. At first, slowly seeing not how far you can go, but can you move without any tension? How can you do it lighter? Then you're going to move the head sideways, rocking it sideways like that, as if you were saying maybe. And what's happening here is that you're sliding the occipital condyle across the atlas condyle like that. So it's a very small movement. And as you're doing this, the joint capsule is going to start to lubricate the joint and allow you to move better without the crunchy sounds in there. If at any point you feel dizzy, then you stop and rest and do it again tomorrow. So again, yes, no, maybe. You're also working for coordination. Can you do this in a coordinated way? Once you can do that, then start to move your head in any direction, in all three planes. Maybe even you can do figure eights in one of the planes. Find where it's tight and move your head across that area. Again, nothing forceful. Always asking yourself, how can I do this lighter? It's the movement that will loosen the connective tissue and the muscles, and it will bring fluid into that area. So this is something that I would start doing at first every day to give your brain new information on how to let go of your head. Then after a while, having a loose head on your shoulders will be the natural way that your brain holds this area for you. And then you just need to do it whenever you start to feel tense or a headache coming on or something like that.